So I've been a nurse at Parkview for 27 years. I knew when I retired that my plans were to always go into the emeritus program. I have a really good friend who was one of the first emeritus nurse, told me all about it and what a great program it was. And so I knew I was going to come back to do that. I didn't know I was going to come back right away. And I didn't know that I was going to come back and work a lot. But because of the pandemic, they wanted me to do vaccines.
I was a nurse at Parkview for 27 years. All 27 of those years I was on Parkview Samaritan. I've been a nurse for 40 years. I retired in 2018, having come down with leukemia, so I sort of had to retire. Had a bone marrow transplant and all as well, successful, leukemia-free. I'd never been through a pandemic. I have worked in my nursing career overseas and saw diseases that you read about only in your textbooks, but this was something totally different. And initially I couldn't be part of it because I had to wait till I got my vaccines. And then I was thrilled because I really did want to help with getting mass immunization, herd immunity done. And so when I talked to Tammy and she said, we have a great need, I used that as a stepping stone to get into there, and it's just been perfect fit. I have various roles there. I vaccinate some days, other days I fill in as a medical person in case of an emergency, and I've even been out front greeting people. So whatever the need is, I just kind of step in.
It's such a great program. So we can come back and help nurses. So my friend goes on the floors and she goes around, makes rounds with the patients, making sure that they're happy with the care. She might get them some water, she might get them a washcloth for their face and their hands. They do a lot of odd and end jobs to help the nurses and to help the aides on the floor.
And a lot of people have come back. There's still a great need for people to come because we still have many openings, and it's a good position. You can work as much as you want or as little as you want. And I think the requirement is you only have to work 8 hours a month. But it brings you back and it gives you a little bit of social activity, especially with people you've shared many situations with and have fond memories of. And I just found it to be a perfect fit, a perfect glove.
To me, it's been great. I've seen coworkers I haven't seen for a long time. I've seen friends. We're helping. You know, we're helping to ease the workloads for the nurses, for the aides on the floor. It's a good thing all the way around, and I'm just honored to be a Parkview employee. I'm honored that they have such a great program for us retired nurses to come back.